Hi, and welcome to Chapter 10. This is Preventing Disease Transmission. In the previous chapter, Chapter 9, we learned about ways that infectious diseases could spread. In this chapter, we're going to talk more about how do we prevent those diseases from spreading. So we're going to talk about medical sepsis, disinfection, isolation, personal hygiene methods that you can use, how the role of the Center of Disease and Control tie into all of this. So when we're talking about emergency diseases, let's talk about COVID. So an emerging disease that occurred the past year has been the pandemic. And the pandemic has really opened a lot of people's eyes to why it's important to use good hygiene and wash your hands and protect yourself when you're out and about, and especially in the hospital role, because we do come in contact with COVID patients. So one of the emergency diseases I want you to think about when we're moving through this chapter is COVID, and how your role during the pandemic changed and how you looked at protecting yourself from COVID. So diseases that occur around the world is an epidemic, and we saw this firsthand. You've experienced this. We can transfer diseases such as COVID from person to person in the hospital if we are not following safety guidelines. So we do have some healthcare associated infections that can take place, and those can be caused from negligence or not properly cleaning off your instruments, wiping down your table. Bloodborne pathogen incidences can occur. We also see things like TB, where a patient is admitted, but they're not put into a mask, and then they're spreading TB throughout the hospital as well. So there are things that we can do to protect ourselves in those types of situations. So when we're talking about, again, emergency diseases, so emerging diseases such as the epidemic that took place, these will be any type of new diseases appearing in the population. And so we saw one of the things that happened with COVID-19 was that a variant arose. So there's a mutation in that strand that we have to be aware of. And it did strand out to the Delta variant, and there were some other variants that emerged. Right now, the push is to get everyone vaccinated so that we stop the transmission of COVID and stop that mutation occurring, so that we can keep up with how to hopefully create a cure or prevent ourselves from getting that disease. There are some existing diseases out there that are in the world, and there's things that we do to protect ourselves. So like measles, chickenpox, we have vaccines that have been created to help protect ourselves against those emerging diseases. And we can see a resurgence of old diseases, and again, we saw that with measles, where people weren't getting vaccinated, and you saw that strand that we haven't seen in a while re-emerging. And sometimes what can happen with that reemergence is that it can cause it to mutate, and then what we have in place for vaccinations becomes obsolete, and they have to come up with a different cure. So infection control department or hospital responsibilities keeping update is the CDC. The CDC is our most complete source of information about infectious diseases in the United States. And they do have a wonderful website called cdc.gov, and they keep you up to date with what they're recommending. So even with COVID-19, you'll see that their page has changed and evolved with the more they know about the CDC. And you heard the involvement of CDC in a lot of critical decisions that were being made, especially by the presidents in regards to COVID. So they play a very important role in establishing criteria that should be followed across the United States. So that disease emergence is precipitated by many factors. We have an increased human exposure to vectors in nature, our population growth and migration to crowded cities, because the more people you have in a city, the more easy it is to transmit that disease. We have a vast variety of ways to get to international travel. So you saw that again with China, and how quickly that COVID variant and the variants arrived to the United States and traveled across the country. I mean, it was a matter of a month that it started to spread across. So contact with new strands of dangerous pathogens. We have that breakdown in public health measures, that climate change. You're starting to see a lot more flooding and wildfires that are taking place. And we also have to be concerned with bioterrorism. So with healthcare associated infections, these are ones that occur more than 48 hours after a patient has been admitted to the hospital. So with these, they're also called nosocomial infections, and they're defined as being more, that's a more recent term that's being used as healthcare associated infections. There are approximately about 687,000 patients admitted each year. And so that's a lot of precautions that need to be taken place within the hospital. And it's estimated that 72,000 patients die each year because of hospital-associated infections. So again, if you hear the term healthcare-associated infections or nosocomial infections, they both mean the same thing. There are disease processes such as MRSA. You have your VRE, your vancomycin-resistant enterococci. These are all ones that are pretty drug resistant, and that's one of the reasons why I said in that previous chapter, MRSA is pretty important to catch early. If you can catch it early with the start of that spread, then it's easier to treat, because once it becomes spread throughout the entire leg, then it becomes more and more difficult. You're talking about people who will have to get debridement done on that leg, so they're having to scrape away the dead tissue from that leg. And so instead of something that could have been treated within 48 hours, it may be something that's now going to require months of treatments in order to save that leg, and in some situations they have to have those legs amputated. So that healthcare associated infections, you also see that those disease processes that we talked about in the previous chapter come into play. And with those, just remember, most treatments are pretty successful with antibiotics, but there are about 20% of patients that will relapse and have some more debilitating diseases that occur because of that. So one of the things that we really want to concentrate on is how do we protect ourselves from those disease processes. So with bloodborne pathogens, you're very familiar with HIV. So with HIV, that did occur back in the 1980s, and at that time we didn't know a lot about HIV, and it was one of those things that took a while and a lot of research to figure out why was it being caused, how was it being spread. There was a lot of inaccurate information when it first came out about who was susceptible to that disease process. We do know that there are two types of HIV. There's an HIV-1, which is pretty much the prominent strand in the United States and around the world, and HIV-2, which is primarily focused in the heterosexual populations, especially in West Africa. So HIV is an RNA retrovirus, and basically that means that it's going to attack the body, including the cells and your central nervous system, and it has adverse effects on immune system, and so these people become very sick and they eventually could pass away. So HIV is the bloodborne virus that does cause AIDS, and when they do get AIDS, AIDS is your body has fully been taken over by that disease process, and it's very susceptible to other diseases. So when you have a patient who is known to have AIDS, you really have to take into consideration what you're wearing so that you don't contaminate and make them sicker. So HIV is transmitted by means of sexual contact, contaminated blood needles, fluids containing blood, placenta from the mother to the fetus, and mother's milk. So for us, one of the things that we need to be concerned about is needle stick injuries, as well as if a patient has hepatitis. So hepatitis, we do encourage you to get your hepatitis B vaccine. We talked a little bit about getting the hepatitis A, but that's transmitted through food and feces. Hepatitis B and C and D are bloodborne pathogens, and so those are ones that you want to be cautious of when you're dealing with any blood products that you could come in contact with. So with hepatitis B, that's more of an infectious disease process than hepatitis C is. It is transmitted through a needle stick injury. That's the most efficient way of transmitting that disease. So we really have to be cautious of how we cap our needles and dispose of those needles. Tuberculosis is another one that we need to be cautious of when these patients come into the hospital. So TB is contagious. It is an airborne lung disease. Those patients are going to mostly be homeless. They may be immigrants. A lot of people will have this requirement for pre-employment just to make sure that they do not have TB. So don't be surprised if your employer requires you to have a pre-employment screening, especially if you're a healthcare worker, to make sure that you're not known to have an exposure to that disease. You will see lots of chest radiographs that are taken for pre-employment for TB. So don't be surprised if you have someone that's had an order for a chest to rule out TB, and it's because they're doing that for their pre-employment. So especially if you deal with the occupational health in your hospital system. All right, let's take a little bit of a look at preventing disease transmission. So we've always had to be aware. So a historical perspective, those infectious diseases have been pretty rampant for as long as we can remember and document. The United States Public Health Service was a legal authority that was detained, and they would quarantine individuals in the past that had especially disease processes such as TB, smallpox, yellow fever. We had to be concerned about Ebola. And so there were some infectious processes that took place back in the day, but they were not nearly as strict on those disease processes as they are now with what you do for isolation and protective precautions. So out of all of that research came standard precautions. So in 1996, the CDC was actually the ones that came up with that standard precautions. And there's been some evolution of that. It became more known as universal precautions. So standard precaution refers to the infection control system, and it applies to that blood, body fluids, secretions, non-intact skin, and mucous membranes. So those standard precautions were put in place to help reduce the risk of transmission. Quarantines have ideally been one of the things put in place to keep people in their houses so that they don't transport that disease process to people in their neighborhoods, their churches, those types of things. And we got to see that firsthand with the pandemic here in the United States, where we were quarantined and asked to limit how much we traveled and how many individuals traveled out to obtain food and water. So when the hospitals were first instituted, infectious patients were also isolated to single wards, and then that's where that isolation technique evolved from that practice and how to prevent yourself as a worker in that situation. So isolation is no longer commonly used for a lot of disease processes, but there are some that still require isolation. So when people have that smallpox, yellow fever, those types of things, SARS, you may still see some community isolation taking place, especially in elementary schools, and they may isolate them in the hospital. So those protective measures, universal precautions, focuses on the barriers against those bloodborne pathogens, and body substance precautions to expand to help protect you against any body secretions. So that standard precaution, we're looking more at the infection control system. It's designed to help risk that transmission of infection. Anything from airborne, droplet, and contact have precautions put in place. OSHA was one of the institutions that came out, and it stands for Occupational Exposure to Bloodborne Pathogens. It was established in 1991 that required employers to develop plans and have those put in place at their work site to protect their employees. And this includes anyone that comes into a hospital system. So OSHA's put in place, and anyone who may be coming in to do work into the hospital environment has to abide by what has been put in place for protection control measures. So if you have someone from engineering that's going into a patient's room, they still have to follow that personal protective clothing and equipment precautions for that room. There must be signs and labels to identify any biohazard material in addition to what those isolation precautions are in place. And they also must provide annual bloodborne pathogen training, hepatitis B vaccinations, and medical care in the event of occupational exposure. So these are all things that every hospital has to abide by, and any medical center. So if you're at an urgent care, at an orthopedic group, you still have to follow that annual training. The term medical asepsis deals with reducing the probability of infection control. So those microorganisms, we want to reduce them from being transmitted. So with these, we do have a process called microbial dilution, which is the process of reducing the number of organisms. So we can do this by hand hygiene, disinfecting, sterilization. So by washing your hands is going to be your number one way and most effective way in controlling that transmission of disease. So the rule is 30 to 60 seconds with soap and water, and they do have your sanitizing stations, so those hand stations where it's an alcohol-based rub that does work as well. With cleaning techniques, just make sure that you're reducing that area for airborne infections and transfer for pathogens by fomites. So keep a clean rag. Don't try to reuse that from room to room. Always clean from the least contaminated area towards the more contaminated area from top to down. Avoid raising any dust. Do not contaminate yourself when you're cleaning these areas, and clean all the equipment that comes in contact with the patient. And that includes our portable machine. We do have to wipe that down, and we have to wipe down our fluoroscopy unit as well. And we have plastic covers for those pieces of equipment when we go into the surgical areas. So the CDC does recommend that we use bleach or Clorox, which is inexpensive. We do mix that bleach in a 1 to 10 solution to effectively decline that solution. So we want to dilute that solution. When we're looking at handling and disposing of contaminated items, we do want to replace linens after each patient. So if you use a blanket to cover up a patient because they're cold, make sure that you place that in the linen bin. So there'll be a place where you put contaminated linens, and that you don't just throw them in the middle of the floor. So use the appropriate hamper. Sharps should be properly disposed, especially because of needles. We want to avoid needles pokes, so make sure you put those in the sharps container. And any blood-contaminated items, such as gauze and bandages, need to go in an area that's labeled biohazard disposable container. They're going to look something like this. They'll have a red symbol, and then they'll be hanging in the room for your needles, and then there'll be another area that has a trash bin for biohazard or bandages. When we're looking at isolation techniques, it is one of those things where standard precautions apply. The CDC recommends isolating patients based on transmission precautions. So you'll have different signs depending on what that patient has. So you have contact precautions, airborne precautions, and droplet precautions, and you need to follow what's written on that sign as to what you wear when you walk into that patient's room. For us as a radiographer, most isolation patients will require 2 technologists, one that has all patient contact and the other one that's going to handle your equipment. You're going to reduce contamination of your equipment by disinfecting it properly, and then when the patient's in the department, use some sheets to cover the table, wheelchair. Make sure you don't use sponges that can't be wiped down. So there's some things that you can do to protect that individual and yourself by taking a look at the equipment that you're using and making sure that you wear appropriate protective apparel. If it's a compromised patient, such as a neonate, you want an organ transplant, burn victim, one using chemotherapy, we're going to use what's called protective isolation or reverse isolation. These will require modified surgical aseptic techniques, and tube radiographers are again required for those areas, or recommended for those areas, so that you avoid contamination. So here's some prep for the isolation area. You want to perform hand hygiene. Make sure that you put on a cap or a hood and that all of your hair is covered, and that you're donning a mask that covers up your nose, and I would wear protective eyewear. Put on that gown, make sure that it's fastened correctly, and then don protective gloves. This is a non-sterile technique if you're using this method. We put our cassette or our imaging plate into a plastic bag, and then when we remove it, here's the person standing outside the room to grab that plate to run it into the portable machine, and then the other individual will continue taking off the contaminated gear that they're wearing. So in your book, they do walk you through those images and what to do, and I also have a couple videos that I would like you to watch in regards to this and how to do protective precautions. And one of the videos does have a COVID patient and a way that the tech became pretty creative on how they obtained that image. All right, thank you so much, and enjoy the rest of your week.